Alright, hi, my name is Savannah. I'm going to be your nurse today. Can you please tell me your name and date of birth?
Rebecca Knapp, 031403.
Great. And do you have any allergies? Okay, good. I'm going to perform hand hygiene and put on PPE if needed. And then I'm going to provide privacy and explain to you that we are doing a cranial nerve assessment today. And the first test that we'll be doing is a cranial nerve 2, which is your optic nerve. And normally we would be using the Snellen chart or the Snellen test, but we don't have that here today, so I'll just explain to you what that is. Normally you would keep your glasses on, or if you wear contacts, keep them in. You would cover up one eye, and I'm going to hold up a number, and you're going to tell me what number it is.
Okay.
All right.
2.
Great. And then cover the other eye, same thing.
4.
Good. And then keep both eyes open.
5.
Great. And then the other test is there would be a chart on the wall, and it would have a bunch of letters on it, and they get smaller and smaller as they go down. And you would read the lowest line possible that you can that's not blurry with one eye closed. And then you would do the other eye, and then you would keep both eyes open. Then the next test is for cranial nerve number 3, which is your ocular motor nerve. And this test, I'm looking for the shaking of your pupils or your eyes. And so for this test, I'm going to have you keep your head still and just move your eyes and follow the pen. Perfect. And then the next test I'm going to be doing is for cranial number 4, which is the trochlear nerve. And I'm going to dim the lights, which will dilate your pupils. And then I'm going to shine the pen light in your eyes and check the size of your pupils to make sure they're constricted, which is really small, or normal size, or big. Okay, and this dilates your pupils. And then I'm going to look in your eyes. Looks good. Looks good. Yep, they're both constricted. And then next we will be doing cranial nerve number 6, which is your abducens. And I'm going to turn the lights back on, which I already did. And then you're going to stare at a distant object way out here, and which is going to dilate your pupils. This is without turning the lights off. And then I'm going to move the pen towards your nose, and you're going to let me know when you see double.
Okay.
Okay, ready?
Yeah.
Great. And then I'm going to do it one more time.
No.
Perfect. And then the next test we'll be doing is for cranial nerve number 5, which is your trigeminal nerve. And you're going to clench your mouth, and I'm going to just feel the nerve on your jaw. Good, and then I'm going to feel your temporal nerve. Perfect, and then can you push against? Yes, good. Great. And then the next test is for cranial nerve number 7, which is your facial expression. So can you smile for me? Go ahead and frown. Go ahead and puff out your cheeks. Beautiful. All right, next is cranial nerve number 8, which is your vestibulocochlear. And this is going to be a whisper test. So I'm going to stand behind you and whisper something in your ear, and you're going to say it back to me.
Okay.
Baseball.
Baseball.
Great. And then I'm going to do it to the other side.
Kate's calling me. Microwave?
Yes, great. That's the facial test. And then the next test we'll be doing is for cranial nerve number 9, which is your glossopharyngeal nerve. And I'm going to be putting the stick in your mouth, and you're going to say ah for me, okay? So stick your tongue out and say ah. Great. And then I'm going to check your gag reflexes. So I'm going to push it down a little bit farther. Okay, great. And then we have just a couple more tests left. So the next one is for cranial nerve number 10, which is your vagus nerve. And this nerve is intact because you can talk to me and you're moving and you can swallow, so I don't need to do any tests for that one. Then the next one is cranial nerve number 11, which is your accessory nerve, and I'm gonna just have you move your head side to side for this one. So can you do that for me? Side to side, good, and then up and down. Great, so that nerve is intact, and then can you shrug your shoulders? And then can you push against my resistance? Good. And then leave them down, and then push against my resistance. Good. And then the last one is cranial nerve number 12, which is the hypoglossal nerve. And you're just gonna stick out your tongue and move your tongue side to side for me, please. Yep, perfect. All right, well that's all the cranial nerve tests. So you did great today. Thank you, patient Becca. All right, I'm back here with my patient Becca, and I have her sitting up on the table with her legs elevated and her feet are dangling so that I can complete the deep tendon reflexes assessment. And the first assessment that I will be doing is to check your C5 and C6 nerve roots. So I'm gonna have you lay your hand on your thigh like this with your palm facing up, and then I'm gonna go 2 to 3 centimeters above your elbow, and I'm going to strike my thumb. Perfect. And then I'm gonna do the same thing to your other hand. Yep. 2 to 3 centimeters above. Good. And then next, I'm going to be checking the C7 and C8 nerve roots. So I'm gonna twist your arm outward like this, and I'm going to strike right above your elbow.
Okay.
So we'll start with your left arm. Good. And just have your hand dangle like that. Perfect. And then 2 to 3 centimeters above right here. Good. And then I'm gonna do the same thing to the other arm. 2 to 3 centimeters above. Perfect. And then next I'm going to be doing the C5 and C6 nerve roots again, which is I'm going to have your hand lay flat like this on your quad with your palm facing up, and I'm going to go 2 to 3 centimeters above where your thumb is, where the bony prominence is right here, and I'm going to strike right there. And then I'm going to do the same thing to the other hand, 2 to 3 centimeters above. Perfect. And then next, I'm going to be doing the bottom half. So I'm going to be assessing your legs. And the next one is your patellar reflex. And that one is L2 and L4 nerve roots. So I'm going to have your hand on your quad like this. And I'm going to strike your patellar. And I'm going to do the same thing to your other leg. Good. Next one is for your Achilles tendon, which is your S1 nerve root, and I'm gonna put your heel in my hand, and I'm gonna strike parallel to the ankle bone. Yeah, take your shoes off. Perfect. Good. And the other one. Great. And next, I'm gonna do the Babinski reflex, which is also for your S1 nerve root. And this one I'm gonna cradle the bottom of your heel again with my hand. And I'm gonna press on your foot from the heel to your toe with the back of my hammer. And this should make your toes almost like point up, like a ballerina. And then if this was an abnormal reflex, then your toes would like fan out. Your toes would come apart. And normally that's like normal up to age 2 in infants, but abnormal for other people.
Do I need to take my socks off?
Yeah, we're gonna take your socks off for this one. All right, and that is it for all of the deep tendon reflexes. Thank you so much, Becca, for being my patient for the deep tendon reflexes and the cranial assessment. Thanks. Okay, so I'm back here with Becca, and we're going to be doing the last 2 deep tendon reflex assessments. And the second to last one is the Achilles tendon, which is testing the S1 nerve root. I'm gonna put your heel in my hand, and I'm gonna strike parallel to your ankle bone.
Other one.
Actually, I'm gonna turn it this way. Good. And then for the next one, I'm gonna have you take off your socks. And this one is gonna be the Babinski reflex, which is also testing the S1 nerve root. And I'm gonna cradle the bottom of your heel with my foot, and I'm gonna press on your foot from your heel to your toe in the lateral part of your foot with the back of my reflex hammer. And your toes should point forward like a ballerina, which is a normal result. And an abnormal result would be like the toes fanning out like this. And the fanning out is normal up to age 2 in infants, but after that age, it's not.
Okay.
Yep, and keep your foot flexed like this. Good. Another one. Flex your foot up. Perfect. All right, and that is the last 2 of my assessments. Thank you, patient Becca. You did a great job.